Welcome to ASRM Today, a podcast that takes a deeper dive into the current topics in reproductive medicine.
I'm Jeffrey Hayes. Today on the show, we're discussing the recent Ethics Committee opinion, Fertility Care in Times of Public Health Crises. Joining us is Dr. Jennifer Kawwass, who is Medical Director, Emory Reproductive Center Associate Professor, Division of Reproductive Endocrinology and Infertility Guest Researcher, Centers for Disease Control and Prevention. Dr. Kawwass, welcome back to ASRM Today.
Thank you so much for having me.
Also joining us is Dr. Katie Cameron, Director of Third-Party Reproduction, Johns Hopkins Fertility Center, Division of Reproductive Endocrinology and Infertility, Department of Gynecology and Obstetrics, Johns Hopkins University School of Medicine. Dr. Cameron, welcome to ASRM Today. Yeah.
Thank you. Thank you for the invitation.
So glad to have you both here today to talk about this. I want to start with you, Dr. Cameron. This Ethics Committee opinion, how did this come about? What was this process like?
Sure. So I think that the Ethics Committee wanted to write an opinion just kind of outlining for membership some of the framework shifts and kind of ethical underpinnings of public health ethics. And, obviously COVID-19 was the impetus for this, but we also wanted to kind of make this hopefully a living document to outline some framework that we think might be helpful for, unpredictable things that may happen in the future. So really kind of at baseline, the conflict that, we all felt as professionals in reproductive medicine when the COVID-19 pandemic first hit and, ASRM recommendations were to temporarily pause fertility treatment. That was obviously kind of against what we are used to doing in terms of advocating for our individual patients. So the goal of this document was to just kind of, review some of the ways in which our framework needs to shift to appropriately respond to public health crises, with the goal of ultimately trying to get back to care as quickly as possible for our individual patients.
Was there any role that for any government agencies or that the government in general might have played in development of these things as the process was going on, or even as the pandemic was going on?
Yeah, I think, in general, the pandemic was obviously evolving very quickly. And I think, a universal theme was that a lot of government regulations were kind of at state and local levels. And so there wasn't, kind of clear sort of larger oversight. And so I think that the ASRM task force stepped in a little bit and sort of provided that role for our society in general.
Let me ask you then, Dr. Kawwass, how did the committees get involved in this?
Yeah, that's a great question, Jeff. So the ASRM COVID-19 task force is something that certainly, of course, didn't exist before the pandemic, and something from which we have certainly learned a lot. But to summarize sort of briefly, once we realized that the pandemic was relevant and increasingly important in the United States, the leadership of ASRM called together a group of individuals from all around the country to form a COVID-19 task force. This was in March of 2020, probably about mid-March. And the task force included individuals that were academic, reproductive endocrinologists, private practice reproductive endocrinologists, infectious disease specialists, embryologists, patients, mental health providers, epidemiologists. So sort of a broad swath of experts from around the country that initially met every 2 weeks and over time every month, and most recently, even less frequently, to sort of review the current data and look at things from the perspective of patients, providers, and then sort of the nation as a whole. And just as Dr. Cameron mentioned, tried to help providers in the United States navigate the pandemic as it evolved.
And I remember also we were, at the time, this podcast launched at the same time as all this was going on, and we were collaborating with the task force in trying to get the updates mentioned and out. And as you said, it was a little bit more frequent, and it's of course lessened up as hopefully we're swinging, out of one phase of things. But I want to ask you, Dr. Cameron, advocacy is such a large part of how we try to get information spread. What do you think is the role of advocacy moving forward? We're present but yet we're looking forward to possible, future problems without pressing a red button or an alarm or, causing some sort of panic, because as providers and specialists and everyone in the field of reproductive medicine, there's been the time that we unfortunately had to recommend that, maybe we need to shut things down to a degree for a while. So, you know what I mean? It's already been sort of a touchy time, but what do you see then as the role of advocacy sort of moving forward?
Sure. Well, one of the things that I think we wanted to really try to highlight with this document is that any pause or cessation of care is going to sort of further marginalize already marginalized patient populations. So same-sex couples, single individuals, people who aren't able to procreate without assistance are already a vulnerable population that, we as providers obviously feel very passionate about. And that, any kind of change in the availability of reproductive services is going to further marginalize those groups. And so just wanting to be, as mindful of that as possible. One of the things that we write about in the document is in terms of kind of short-term mitigation, sort of what providers can do in the immediate setting of a public health crisis to try to, things to consider to try to be able to reoffer care as quickly as possible. And then, sort of longer term things in terms of how to better ensure safeguards of access to care for those populations, including continuing to lobby for expanded insurance coverage. Potentially, this pandemic has given us a lot of opportunities to think about how telemedicine may help extend our reach and our ability to access patient populations that may not have reproductive medicine immediately available to them, that sort of thing, to just kind of be mindful of the fact that this is going to, any sort of public health crisis and shift in care is going to sort of further marginalize those populations that are already vulnerable.
And I think we also learned the importance of inclusion of pregnant women and people in the periconception period in vaccine trials and scientific research. This pandemic really made it obvious how much the data that were specific to pregnant individuals and those in the periconceptive period were sort of delayed in getting enough data to feel confident in vaccination. And so we ended up sort of having to make up for lost time and share the data as it became available. But it would have been really tremendous if from the beginning there was publicly available data suggesting vaccine safety in the preconception and early pregnancy and during pregnancy period. We now know that data exists, but it would have been nice if they had not been excluded initially.
Absolutely. And that was something that we wanted to highlight as well, that, that's really kind of a tenet of informed consent is part of having data available to make an informed decision. And so when pregnant persons are excluded from those trials, we're really, denying them the same opportunity that others have to collect data in kind of a controlled research setting. And instead, we're asking, pregnant people to make decisions about their health based on a paucity of data.
Recently, through the website, back on March 2nd of this year, it was published COVID Reproductive Health and Public Policy, Lessons Learned After 2 Years of the Ongoing Pandemic from the ASRM COVID-19 Task Force, which ties into our conversation today. I pose this question to you both. Can you talk a little bit about, there's a term in there about, it says about being nimble. I was wondering if you could maybe discuss that a little bit further.
Yeah, absolutely. I'll start and then Dr. Cameron, I'm sure, can jump on in. I think this is relevant to not only this pandemic, but those that may come in the future. Just this concept that the data and the science evolve over time and the recommendations as a result may evolve over time. And similarly, the sort of balance between the individual and what's best for the social good of the whole will also evolve over time. And so I think this, in some ways, as difficult as it's been, has been a tremendous learning experience in terms of ways that we can come together as a nation, involve people from all different walks of expertise, and come together with our patients and providers' best interests at heart to sort of navigate the evolution of a crisis as it unfolds.
So I think you're exactly right. And I think that one of the things that this document tried to do was just highlight some kind of higher level themes that we need to be cognizant of as we navigate future crises. Because exactly as you said, the next crisis, it may be a public health crisis that looks different. It may be an environmental crisis. It's kind of hard to predict exactly how individual rights and societal needs will need to be balanced when the time comes. And so that's one of the things that we were trying to do, is to write something that was a little bit enduring, but that may help frame future challenges that we'll face as a field.
Well, I'm certain that everyone can agree that we all hope there's a little breathing room in between now and whatever that is that might come next down the pipe for us. We will link to all the documents we discussed today in our show notes. You can just go down, scroll through there, click on that, and it will take you to read these things. My thanks today to my guests, Dr. Jennifer Kawwass and Dr. Katie Cameron. Thank you both so much for being on the show.
Thank you so much for having us. It was always a pleasure.
Yeah, our pleasure. Thanks a lot.
Please subscribe and rate the show through Apple Podcasts, Google Play, Spotify, or wherever you get your podcasts at. Until next time, I'm Jeffrey Hayes, and this is ASRM Today.
This concludes this episode of ASRM Today. For show notes, author information, and discussions, go to asrmtoday.org. This material is copyrighted by the American Society for Reproductive Medicine and may not be reproduced or used without express consent from ASRM. ASRM Today series podcasts are supported in part by the ASRM Corporate Member Council.
The information and opinions expressed in this podcast do not necessarily reflect those of ASRM and its affiliates. These are provided as a source of general information and are not a substitute for consultation with a physician.